people on campus should not assume that we get everything we need at drill or on the military side. Sometimes we do, but a lot of times you have to go to extra lengths to actually get that. You would have to find somebody that you trust in your chain of command if you really were going through something. And I kind of want to say that we're kind of wired not to do that. It's a pride thing, and it's a fear thing too. But yes, people on campus should not assume that we've got it all together, because we don't. We do not.
Well, I'm in the Army Reserves, so I don't have to see my unit every day. So I don't really fear that anybody would find out, so to speak. But if I was active duty and I had to be around those people every day, you have there are military psychologists and social workers, which I would be concerned then that somebody might find out. But I will tell you a story. When I was in Kuwait, it was very stressful. Not only for me, I think the transition of just being in another country, not knowing what to expect, whatever the case may be, it was stressful for a lot of people. And some people had reactions to being there, and they actually got sent home because I guess they were deemed unfit to be in that kind of environment. So that in itself would make somebody worry about coming forward if they were having issues, because if you do, you might not want to go home. Me, myself, when I got there, because I wasn't going to be able to see my therapist anymore, I did seek help from the social worker that were there. And they have what they call behavioral health specialists that are enlisted, like the ranks E1 through and up. And then they are supervised by an officer, which is a different ranking system. But I started out seeing them, and their supervisor, the social worker, told me that, she would meet with me. And I ended up sharing some information with her about what was going on in the unit at the time. And somebody else found out. She was the only one that knew. So I know that she confided. She must have been friends with the person that she told. And so that person found out. And I found out. I wasn't supposed to find out, but I did. And I stopped seeing her. And there was a sense that I couldn't even do anything about it because it was my word against hers, because she was so high ranking and I wasn't. So back when I was seeking a therapist, this was before I left, so I would say 2016, back when I was deciding who I wanted to see, I actually did go to the counseling center. And they told me that, and I was looking for more of a commitment, somebody that I could see long term, just in case, somebody that I could build a relationship, somebody that I could trust. And when I went to the counseling center, they told me that they only offer 8 sessions. I don't remember if it was for the year or for the semester, but I was afraid that if I needed more than that, I wouldn't be able to count on the counseling center. So I chose not to do that. Now, my insurance at the time did cover providers, so I went online, looked to see how many, I looked to see how many providers I could come up with that would accept my insurance. And I think I narrowed it down by specialty. And then from there, I took the first 10 and I started making phone calls. And I actually, before I called them, I had wrote down a list of questions that I wanted to ask them about their experience. I interviewed them. And the first 3 I called, they didn't answer. 2 of them called me back. One said, I don't want you to think that you're not important, but I just want to return your call, but I'm busy now, so we can talk on Monday. So I said, all right, well, I'm not going to talk to her. And the 4th one I called, she answered the phone. She had a moment. She answered all my questions. She said that nobody had ever done that to her before. And from there, I decided that I'd give her a shot. And I've been with her ever since.
I'm very strategic on who I ask for help and how I communicate with people. Even with my current profession as a teacher, I don't talk to my administration. I'll talk to my other teachers, and I'm very selective. I could analyze a person and decide what I could talk to them about certain things. I'll be very selective. I'll keep my circle small, and I'll make it happen. But I'll be effective in doing it. Well, the reason I went for help was because there came to a point of where I was actively involved, with stuff that I've gone through in active duty, working full-time as a teacher, spending my time as a student at New Paltz and doing my reserve time, that it really piled up, and I didn't have the same resources that I had in the military, of where I had a battle buddy to my left and right that I could talk to and go work out with and do all that stuff. So I was left alone to a certain extent. And I called on certain people, but you call on your people that you worked with in the military, but they're in Seattle, they're in North Carolina, they're in Germany. It's not the same friendship anymore. So it's growing and matriculating, and I didn't really adjust well to the civilian side. And that's why I had to seek out counseling, because of everything piling up and I had nowhere to release. And I tried going the VA route. It really wasn't too available. The VA wasn't too open. I've called, left messages to make appointments, didn't get any callbacks. And I started entrusting in this other gentleman that I met that was close to my age, same gender. He didn't mind that I cursed in front of him, so it's been an ongoing thing, a relationship within therapy, that I've been able to talk to him, and he just sits there and absorbs it. But it's been working for me for the last year. In my own mindset, I think this fits within the stereotype of most military, is that I didn't care what he thinked, but I just was going to go there and I was going to blurt everything I had in my voice and opinion, and that was going to be my own therapy of just release. So I went in there punching a bag. He just sat there and absorbed it, and he listened, and he asked appropriate questions back to me, so it helped. It's not that he was prying at any of my military experience or stuff that I've gone through, so it sort of helped in that way, that he wasn't asking too much about what was going on.
That was one of the reasons why I sought a counselor, is once I kind of started going down a spiral and started talking to my friends again. One of my friends who's dealt with depression his whole life, one of my best friends from the Marines, told me to go seek a counselor. There's no shame in it, and I did. So it's having that peer-to-peer support, having people who have been through what you've been through tell you that it's okay, carries so much more weight than somebody pointing a finger at you saying, do it if you need to, like someone that doesn't know you in a personal way. It just does, because I would like to say I'm stubborn. I'm a very stubborn individual, but having my best friend tell me that, there's no shame in it, there's no harm in it, it definitely helped. I definitely was more comfortable seeking out help through a VA counselor, because even though they're not veterans all the time, they at least deal with veterans all the time, and they get the training to talk to us. And that kind of comes back to, not seeing a school counselor comes back to what I was saying before, where it's like the problem they deal with on an everyday basis, and I'm sure there are people who have legitimate issues that when they go see the counselor, it's some like heavy stuff, but my ex-girlfriend was a school counselor for her internship, and she told me 90% of the problems were things that even she was like, really, you need to come talk to a counselor about it. And she's a very caring person, so I just feel like going to see a school counselor, just knowing that little tidbit of information from someone who did the job, just kind of they probably end up listening and probably refer me to somebody else anyway.
It'd probably be either civilian or on campus. Kind of like a convenience factor, you got to kind of travel to go to the nearest VA. I think the nearest VA is Kingston, so that's at least 20 minutes or something to go. So it would probably find someone local, someone out of the way. That way you wouldn't be noticed, or on campus you would try to. It would be a little bit harder because someone might see you going to the health center several times a week and be like, what's he doing? It's kind of odd that he keeps going there. So you probably lean towards an individual practice, someone where you want to get noticed often.
I would probably go outside of the campus counselors, just because, like I said before, I haven't been there before. Also, I don't want to assume that they don't know how to deal with these things because I haven't gone there, but just because it's a campus facility, I do assume that they don't know how to deal with our issues, and I would go outside of that and find a different provider.
As far as I know, yeah, they're not trained to deal with a veteran who is in a dark place, you know. I guess that's the best way to put it, because usually when a veteran goes to see a counselor, they're usually in a dark place, like depression or suicidal thoughts.
Understanding like all the terms that are used in the military would be kind of difficult, but I think the overall like illness of depression, regardless of its source, there's some commonality between someone who's in the military and someone who wasn't, but who still struggles with it. It's just, I guess, the sources, the cause of it, that's where it's different. Yeah, I mean, like there's a lot where, you know, if someone talks about their deployment and some of the stuff they may have seen, that may not be, someone may not want to hear that, you know? They don't want to see like hear stories about people getting blown up or whatever. So you need to be a little thick-skinned, because they'll probably pick on you too. It would just be struggling with the lingo, you know, in the jargon of being in the military that might create some barriers at times, but overall, no. But I think someone who hasn't had experience with a military member or a veteran would still be able to help a lot. Maybe not as much as someone who does, but I think they could do it.